Well, this is going to be a dialogue, and I think after listening, I was not able to watch the full Tucker interview to go into every area you guys touched on. But again, more importantly, I'm here to talk today about your book and helping people become more aware of your book. All right. So you guys are probably seeing that in reverse, but nonetheless, The War on Ivermectin. When was this published?
June 6th, of last June 6th. So we're
2023.
yeah, we're almost getting towards a year.
Yep,
Yeah.
2023. So not only do I have a bunch of places earmarked and bent and notes taken for questions, I it's funny realizing back in 2020 how my world changed with waking up to the level and the breadth of the corruption. So I feel like my life completely changed, even though I've been dealing with big pharma and overall the medical model as a chiropractor for my whole entirety.
Yep.
So, from a professional standpoint, I can appreciate how hard your journey went in the book and why there was such a massive movement to stopping all the things you were trying to do to allow people the best, most effective treatment.
Wait, I want to say one quick thing. You said that, you woke up. I mean, you've been awake for about corruption for a long time, but you mentioned 2020, and I just want to point out in 2020, I thought what I was observing was collective institutional stupidity.
Mm.
It wasn't until 2021 where I realized, oh boy, they're not stupid. These people are depraved and just anyway, so it was funny because 2020, I mean, I was really active in 2020, but I really thought everything they were doing was just ignorance and stupidity. And yeah, I woke up in 2021 and I still learning everything today. And the layers and layers and layers of just won't stop.
Well, for some people, it's crazy. I think I will not do this intro justice, but I will point out a couple things. Now, Dr. Pierre Kory has a storied history in internal medicine and specifically as a intensivist. For those of you who don't know what that means, I'll let Dr. Kory explain that, but also his ultrasound pulmonary research and how influential and really instructional throughout the world that he's been in developing this. And so the pertinence of that, which I want to make sure the audience gets, because some people are hearing you for the first time, imagine that. But there are, right? So some people hearing from you the first time have no idea how you came from one place as a rock star, and those are my words, doing what you do in your profession, and then having to completely pivot, let go of all that foundational scaffolding that was there to then create uh, new roads and
Yeah.
all the changes that go with that. So
Mm.
again, that's just part of your story, but I think it's important for people to realize how challenging what you're facing has been and how grateful we are that you're willing to take on that challenge.
Yeah. Yeah, it shows that you read my book, Wade, because I go through a little bit of my past history in medicine and you mentioned the word intensivist. So for those who don't know, it means as I was a specialist at critical care medicine or ICU medicine, meaning I was in charge of taking care of the sickest of the sick. And those are all patients with active, acute, life-threatening illnesses. And it's a high stress job with a lots of different skill sets that you have to deploy. And but yeah, I was mostly known for being a pioneer in the development of critical care ultrasonography, where I taught doctors all over the world, all over the country, how to make life-saving diagnoses at the bedside, armed with like an ultrasound probe, and looking at hearts that were failing, right heart, left heart failing, pulmonary emboli, whole host of things that we could answer quickly. I mean, it was so transformative, that technology. And I wrote a textbook that's second edition, 7 or 8 languages. And so, yeah, I had major impacts. And I'll tell you a funny anecdote. A couple of weeks ago, a former fellow out of the blue sends me an ultrasound image of what was wrong with it. It was huge endocarditis, a big thrombus on the aortic valve. And I look at it, I'm like, oh my gosh, I haven't looked at an ultrasound image in like 3 years, and I actually wrote back, I hope this is appropriate. I wrote back and was like, hey, that's so cool. Send me some more ultrasound porn. So I used to love looking at those images, and we all save the more arresting, the more compelling, the more insane images. And so that's what I used to do all the time. I realized that that part of my life is gone.
Wow. Something you enjoyed so much too, and that was
Oh yeah.
innovative for you and challenging, right?
Oh, I love learning ultrasound, and I was really a high level expert. I put together 3-day conferences all over the country. I probably ran like 70 of those in my career and did some in China and Spain and other countries. And so it was fun. I mean, I was an educator. That's what I do. And I love teaching. When you learn something really cool, it's good to teach it. So that's what I did.
So that said, it segues us into the way you used to be able to practice. Tell me about what you were able to do and what medicine docs like yourself were able to do in the arena that you can no longer do. And your book highlighted very well as to all of a sudden these lines were drawn. Tell us more about
I
that.
mean, that's so yeah, I was able to do anything. If I thought a patient needed this or I wanted to try that, I could do it. No one challenged me. I was never restricted, with one exception, which is something I never even ordered anyway. But uh, I intravenous Tylenol is extremely expensive, so they had like a hard stop around that. Like you literally had to call somebody who was in charge of giving approval. So I just use that as an example of how we could use anything we wanted. The only things that were restricted were things that were really expensive. Fast forward to COVID, and you saw this rigid protocols and structures be deployed where you couldn't think outside the box. You couldn't use something which might have had imperfect evidence. Just common sense stuff like, for instance, let's just say ivermectin. Maybe there was a time where the evidence was uncertain. That's certainly not now. But you look at it, it's one of the safest medicines. Let's say you just had a one little study that showed it might be helpful. Why wouldn't you try it? It was world's safest medicine. Why wouldn't you try it? No. Like so you can. And then if you look, like the cartoon that ivermectin became, they literally conducted a public relations campaign, public health agencies, professional societies demonized that medicine more than they ever did OxyContin. Like,
Right.
did you ever see like the famous memo from the AMA and the American Board of Pharmacy where they had in big headlines, "We call for the immediate cessation of prescribing and dispensing ivermectin for the prevention and treatment of COVID." And I'm reading this headline. I'm like, these societies are going nuts over one of the cheapest, safest drugs ever. I was like, the world has gone mad, completely mad. But I mean, and that applied to everything. I mean, I don't know if you know, I think I talk about it in the book, but Paul Marek's case was so instructive in that, right? So this is during the height of the psyops with vaccines and all of the attacks on repurposed drugs, like hydroxychloroquine. That book is called The War on Ivermectin, but one of my colleagues could have written a book, The War on Hydroxychloroquine. Same tactics, same results. But there came a time where suddenly, out of the blue, the one chief administrator of Paul's hospital, they hated Paul because Paul was so powerful, he's so well known, so famous, and they issued a hospital-wide memo saying that the pharmacy will no longer fill orders for the following. And it was literally everything on the FLCCC protocol. So here he is, Paul. He's the chief of the division of pulmonary and critical care. He is one of the founders and leaders of the FLCCC. He's been kicking butt treating critically ill patients with COVID, and now his hospital sends out that we will no longer fill these things for COVID. And Paul went back to work the next week. He was so upset, and he had 7 COVID patients in the ICU. They all died that next week. He couldn't use any of his ammo, any of his weapons, and it was clear to him at the end of that 7 days that he could not practice as a physician anymore. And so he took them to court. And we have all these videos of that court case. So many people showed up at the courthouse in support of Paul and everything. And he basically said that, he was trying to argue that a hospital has they're essentially practicing medicine. Hospitals don't practice medicine. Physicians do, right? And unfortunately, ultimately, he didn't win the case. I think the fix is in the courts too, but that's a topic for another conversation.
Well, you're right. I mean, the DOJ is showing what they're representing it these days for sure. I am pulling up an article since it's pertinent today. as you're fully aware of. And of course, there's a pop-up screen that's got me limited. That's fascinating. It's the CNN article that says the FDA settles lawsuit over ivermectin content doctors claimed harmed their practice. You're fully aware of that, I'm sure.
Well, Paul was a plaintiff on that case. So um, that was big news cycle in the last couple of weeks because the FDA literally reached out to Paul, Mary Talley Bowden, who's also a really outspoken advocate out in Houston. She is awesome. I love her. And then another guy, Robert Apter, who did a lot of early treatment. But they literally reached out to them and agreed to a settlement, which is that they would take everything down they ever did against ivermectin, all social media posts. They had to change their own ivermectin page, and literally admitting. So basically, what they admitted is that they exceeded their statutory authority. They tried to insert themselves in the practice of medicine. Okay, let's say that's just what they were doing. That's the only thing that was about that is that they just forgot that they overstepped what they're supposed to do. I would like your listeners to ask, why did they do that? Why did they go the warpath on a medicine that's already FDA approved, been around for 40 years, one of the safest medicines? And why were they making fun of it and advising patients against taking it? And there's really only one answer. It is a glaring and brazen example of federal regulatory capture. They were working for pharma to do that. Ivermectin was a huge threat to the entire markets for the vaccines and Paxlovid, molnupiravir, monoclonal antibodies, and then our favorite remdesivir, right? So, I mean, ivermectin threatens so much, and that's kind of the core of the book is what it's really what they do to cheap, repurpose, and let's say alternative. Not that your alternative way, but what they determine as alternative, right? It's something that doesn't make them money, and threatens their markets, like cheap, simple therapies that they can't. Allopaths will threaten their market space. Is always discredited and attacked, right? Fringe, quack, all this stuff not studied, ignored. And really, what really happens as soon as you start studying these cheap, safe, effective medicines and you come up with a positive study, what's the next thing that happens? They come up with a bigger and negative study. And it's literally you see this war rampaging in science, and nothing more nothing more evident and really tragic than vitamin D. And you probably remember because I write in the book like I kind of chronologically go through my COVID journey, and I talk about how I gave that testimony on ivermectin in the Senate for Senator Johnson, um, and it went viral. It kind of put me in the FLCCC on the global map, and lots of bad stuff started happening to us. And I was like, "What the?" I like I've said before, I didn't think I was going to get a ticker tape parade, but I was like literally just teaching what I found out as I discovered that ivermectin was a highly effective treatment for COVID. And as I tried to put that message out, boy, was I starting to get attacked, denigrated in the press, papers getting retracted, lost my job. I'm like, what is going on here? But then in March of 2021, so about 4 months later after my testimony, I got an email one day from a guy I didn't know, and he just said, "Dear Dr. Kory, what they're doing to ivermectin, they've been doing to vitamin D for decades." And his name was Professor Grant. He's out of San Francisco, and he's like one of the world experts on vitamin D. And he's written extensively of how polluted vitamin D science is. And like there are just massive trials of vitamin D designed to show that it doesn't work. And
Mhm.
it populates the scientific literature. And so you'll see articles in magazines where like these science journalists, either they're stupid or they're paid, but they will literally like I saw one in Forbes like 6 months ago. The headline was "Stop it with the vitamin D. It doesn't work." And I
Right.
read the article and he's just citing all of these studies showing that it doesn't work for rheumatoid arthritis, it doesn't work for cancer, it doesn't work for preventing infections. All of those are brazen scientific frauds. And the tactics in which they do that to vitamin D, they use the same tactics as ivermectin. It's about timing, dosing, duration. They just tweak those little knobs and they come out with the result that they want. It's a tactic called the fix from the disinformation playbook. It's basically conducting trials with predetermined results. They are really good at it. Scientists are really good at that. And so I'm kind of jumping all over the place, but that's just sort of some of the things that jump out at me.
That's okay. That's perfect, by the way. You're doing great. It's all relevant. To that point, you had mentioned the dosage that they used was ridiculously. In fact, I think you said, quote, correct me if I'm wrong, it was a homeopathic dose of ivermectin, and as well as possibly in the corticosteroid arena as well, correct?
I probably didn't use the word homeopathy. You know why? Because I don't want to denigrate homeopathy.
Right, right.
I probably would have 5 years ago. Yeah, whatever. But now I know some really skilled practitioners who get results. And so anyway, but yeah, the dosing is just classic. And my favorite, the most brazen example is the largest trial on ivermectin, which is called the Together trial. They literally wrote that protocol and started the trial with a single dose of medicine. So basically, you would enter this trial with COVID, and they would give you one dose for one day. Now, about, I think, a month or a month and a half into that trial, I think they realized that that wasn't going to work in terms of if they published that, no one would have concluded ivermectin doesn't work. We would all just conclude like, yeah, one day of ivermectin doesn't work. So they knew they wanted to get like a something more believable to show that ivermectin was, so they changed it to 3 days. But I just want the world to remember the largest trial on ivermectin, massively pedigreed investigators and studies from huge institutions decided to use a purported antiviral for one day. There's no antiviral in use, which is less than 5 days. Most of them are 7. So the idea that you would use a drug for one day is absolutely joke. That it just, I mean, the amount of fraud that got exposed to me from being an expert in ivermectin, because once I was an expert, and I know trials, I know how to read trials. I mean, I'm just like, whoa, whoa, whoa. And like on my Substack, I mean, I spent months just absolutely hammering away, exposing all of the stuff that they were pulling with these things. And, it's sad to see, Wade, like you're talking about people who are professionals, highly educated at the top institutions in the world, and you're just watching them like do these hit jobs on medicines. And it's
Yep.
like, how do you sleep at night? How do you sleep at night? And it's shy, that's the other thing you learn about the world. It's not everyone's as friendly and moral and ethical and honest as you kind of assume everyone is. And that's been a little bit demoralizing. Like I've seen so much stuff which has led to needless death by people in white coats, leaders who are either knowingly, willfully complicit or just ignorantly complicit or just silently complicit. I call it the conspiracy of silence. I think there's immense numbers of professionals who knew everything going around them was fraudulent and hurting patients, and they just stayed silent.
Well, let's go back then. You may not feel as comfortable talking about this from respect, an acknowledgement, a confirmation as to what it's like to stand up to this biggest mafia, the biggest cabal in the world. You had mentioned, how much is spent? 656.6 billion, is it, in pharmacological lobbying?
Oh yeah, no, it's 660. I think it's six. It might be
Yeah.
666,000, but maybe I'm off by one number. But it's around 660,000 per year for every member of Congress.
For
And
every member of Congress.
when you
Okay.
add the two houses together, it's like something like 525 members or something. But that is the largest budget per
Yeah.
politician, federal politician, than any other industry. And I think it's 2 to 3 times the budget for like the coal and gas industry. That's
Yes.
why they call us the United States of Pharma. Pharma runs this, but well, it's actually run by the military industrial complex, but that's another conversation for another day. See all the rabbit holes I went down, Wade?
Check that box, and I 100% agree with you there. That's why we've been under martial law for the last 90 years, and it's not going to change because they get to that's when they get to EUA, right? So if it's an emergency, they get to usurp rules and civil rights. So we don't have to get into that, but the real challenge here that I think people, and why I think the book is really important for people to grasp, is you tell a story in there very brilliantly about and you obviously became a writer because you'd shared with me before you weren't a writer, and you're like, I don't write books, but yet here you are writing a great book that told a great story. Um, and so in light of that, I really enjoyed the style of writing. the way you noted certain things too, and how you communicated with those. We were just having a conversation. Uh, and as you cited the story after story, it was coming at you, and every time you felt like there was a breakthrough, or man, we've got so much evidence on our side. And this is my paraphrase. All of a sudden, they would just thwart it with their highly strategic and well practiced moves. Um,
It's
I just
why the
found that
title
fast.
of the book.
How about India? Can you talk about India's results?
Yeah, I love talking about India. Um, so I have a book in there, which is, I mean, a chapter in there, which is called The Miraculous Success of Uttar Pradesh. And to be honest, it's such an amazing and beautiful, like public health story. That sentence sounds really crazy, but I mean, there's nothing that's amazing and warm and beautiful about public health anymore. But um, what happened in Uttar Pradesh is, to me, the single greatest achievement in public health in all of history, right? So you have here a northern state of India, which has 244 million people, which would make it, I think, the 10th largest country in the world if it was a country. It's only one state in India. And it's a state led by a Hindu monk. He's the chief minister. And right at the onset of COVID, he assembled this thing called Team 11, which is like the top epidemiologists. It was a nice mix of like clinicians, public health experts, epidemiologists, virologists. And right away, they had a national campaign using hydroxychloroquine. So all the healthcare workers, that was on the national protocol. They were treating aggressively with that. Then when ivermectin started to be talked about, by the way, they employed ivermectin in their national protocol in August of 2020. The FLCCC did not have ivermectin on our protocol until October of 2020. So if anyone thinks that we invented or first recognized ivermectin, you have like one of the largest states in India that literally had it on their national protocol. And it was such a massive public health program. So this is what they did. They hired, and I don't think I think I'll get my numbers right. 166,000 healthcare workers armed with rapid testing. Um, they traveled across the state to 97,000 villages. Testing, 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 testing. All the healthcare workers were on ivermectin. Every positive test got a kit with ivermectin. Every positive test, the household got treated with ivermectin for prophylaxis. And they started to kind of obliterate COVID. You can see the numbers, and it starts to go down. Like when they started that American program, they were like 16th best in terms of cases and mortality in India. And very slowly they start going to like number one. And there is this huge spike during that Delta wave in India. Remember that catastrophic Delta wave? And that during that Delta wave, and that broke out in India, millions of migrant workers who don't live in Uttar Pradesh. Many of the migrant workers to the other cities in the country come from there. So they all started fleeing. This is April of 2021. They started fleeing back to home because they got locked down the year before. They couldn't have access to food. They couldn't work for their families. So they get the heck out of the big cities trying to go back to Uttar Pradesh. And so there was this huge surge of cases and deaths but guess what Uttar Pradesh does? They start going to the airports, the bus stations, the train stations, testing, testing, testing. And so there's a spike, but it's a really sharp. You've never seen a spike like this. You know the waves, like remember New York Times would give you these waves of all the
Yep.
cases, and like this is what Uttar Pradesh looked like in Delta. It was like they extinguished Delta in a few weeks. Fast forward 6 months later, September of 2021, the newspapers start reporting the numbers. And I remember there's one newspaper, September 16, 2021. This is what they report: that in the last 2.5 million tests they conducted in Uttar Pradesh, there was 211 positives. That's like a 0.0007. It's effectively zero. They
Yep.
also report that in 67 out of the 75 districts, there was not one active case. So can you just contemplate that for a second? Wait, that would be like the New York Times saying that in 40 out of 50 states of this country, not one single active case had been identified. I mean, that's insane, right? That's got to be made up. I mean, that's why I call it the miraculous success of Uttar Pradesh. And then the bad stuff about it is And I have the trail of newspapers that it was tracking this program. So early in 2021, you read these reports where the newspaper articles in India are literally saying that they're using ivermectin and how well it's working. They're talking to public health officials so you see the words ivermectin appear in the newspaper articles. Around May of 2021, you can't find a newspaper article about what Uttar Pradesh is doing where the actual treatment that they were administering was mentioned. Ivermectin gets completely obliterated from the newspapers. And even on that day where they announced these insane numbers that you couldn't even believe, ivermectin is not mentioned at all. They just stopped talking about what they're doing. And this is how absurd it got. So WHO did they posted this really celebratory article about Uttar Pradesh because what they were doing there was so amazing. But the whole article showing how great Uttar Pradesh was focused on their contact tracing, quarantining, testing, and surveilling. And then there's a little mention that there's a treatment kit that's given to people. It's nothing about ivermectin. And the pictures of the article show people like with masks going door to door and stuff.
That's part of creative reporting and creative writing, right?
Yes,
It's like creative bookkeeping. We'll make the numbers work for us.
yeah.
So that is pretty obvious. You have story after story as to the realization, the great awakening of your life, the great awakening of the whole system you've been a part of. And again, I'm not here saying, I mean, you're just I love this, and I've shared this with you in the past, is the ability to pivot and actually do what's more uncomfortable, do what, and you don't feel like a hero. You've told me that before. I've heard you say it before in other venues, but yet you are a hero. You're a hero for standing up for something, and that's what we need more of. So to the next question, these are maybe short answers for you. All right. Could be very short answers.
Sure.
Was healthcare political prior to 2020 to you?
No.
Okay.
Can I give a favorite meme on that was because like with ivermectin and hydroxychloroquine, suddenly it's like right wingers were all for that. The left thought it was a horse paste, right? And so suddenly you had these opinions on medicine which were divided along political allegiances. And so the one meme that I'll never, this is a short answer. The one meme that a friend sent me, someone posted on social media, they said, um, who likes penicillin better, Republicans or Democrats? You know what I'm saying? It's like that's to show that's the answer. You're like, we were never political about medical therapies before. Suddenly now medical therapies are divided along political lines. I mean, just crazy.
Yeah. So there's the next question. After 2020, is medicine and the practice of medicine political?
Oh, for sure. For sure. I mean, everything's been flipped though. Like, I mean, I'm an old lefty, no longer because left isn't the left anymore. The left is the right. I don't know what's going on, but like when I was a liberal in college and I was kind of supporting left, I mean, I was totally anti-big pharma. I did have an implicit faith and trust in the government. But I was anti-corporation, anti-censorship, all of these things that are now being propagated by our government. So flip to where I am now. Now I realize our government is corporations, the media is corporations, and we have a corporate controlled everything. Our government and media is corporate controlled. And I'm literally fighting against that. But now I'm doing it from the right because the right has long held a distrust of government, right? Well, maybe the Tea Party more than the Republicans, but like, small limited government now, like my true political belief now is like almost Tea Party like. And I used to hate hearing the Tea Party. I thought they were trying to ruin everything. Now I want as small a government as you possibly can. And so, so what you have, when you said, what about now? Along with that, like I saw, like the left just trusts the government. And when the government says this drug is bad, this drug is good, the vaccines are safe and effective. I mean, they are like rah-rahing the best, here's the other way of saying it, is that the left or the majority of this population, they have an implicit faith and trust in the institutions of science. And I have to say, I did. I believed the journals, I believe the agencies. I mean, I was never given any information to not do that. I thought the best science and scientists were published in those journals. And now, and the right is very distrustful what the government says. And so like the right, you've seen the difference in vaccination rates between left and right, and the distrust between left and right. And so, and I'll tell you, because of that distrust in a captured government, the right was right. Huh? Clever? Huh? Witty?
Beautiful. Beautiful. Yeah, and that is, it's beautiful. And I love the way you just kind of tied all that in, because the honest perspective or the transparent perspective there is, yeah, there's been a change, number one. And how has it flipped? Because liberal in the past by our forefathers was about freedom and independence, and that has flipped to now lack of independence, which is dependence, relying on everything from the government. We will tell you exactly what you need, when you need it, how you get it, and we're going to usurp your own rights. So instead of me making it about politics, I think most people are somewhere in that middle, right? So let's
Yep.
just say here's the extreme. You got extreme on one hand, extremes on the other, and then most of us are in this 80% somewhere to the right and to the left, which have moderation in our eyes. We see human beings for who they are, not the color. I mean, it's just this natural process that's getting gaslit on the extremes. And in the healthcare model, which breaks my heart, the point of the relevancy of why I asked that is, if healthcare has become political, how are you going to choose your health? How are you going to make decisions? Back to you, knowing what you know now after writing the book, seeing the hurdles that patients face to access actual truth in healthcare. What do you recommend for people? What do you recommend? Because you have your private practice. I've got some numbers there that you had stated. I'll let you answer that first before I come back to the percentages about long vax, long COVID that you talked
Yeah,
about.
yeah. I mean, what would I recommend? Wait, that's a really difficult question. I mean, here's how I view it. I mean, most people, so I live in a different world with a different network. The people I know and work with, some people call the medical freedom movement. I would say the medical resistance movement. But the way I see system medicine, and how it's so corporate, you have all these huge hospital chains, and then they got even more rigid in COVID. Like most people I know are scared. They do not want to go to the hospital. They don't trust the white coats. I mean, the erosion of trust in the medical profession has been precipitous, at least in my worldview, where people I hang around with, and the doctors that are with me. But they don't want to go. And so what do you do? Where do you go for your healthcare? I mean, I think a lot of you, and private practice has been declining rapidly over the years, right? The amount of doctors who actually work for themselves is really low. So you're left with like kind of these direct primary care places where you generally have to pay cash, right? Insurance doesn't work, although there are solutions for that, like these kind of what are they called? Meta-share organizations, like where everyone pays in, and then when you have a medical cost, you just apply, say, hey, can you pay for my hip? And they'll pay for the hip, And so there's some clever ways of getting, fee-based care, but there's no easy answer. And then when it comes to COVID, I mean, the system is, I have never seen a system fail at a disease to the extent and scale that they have with COVID. And like as you kind of wanted to allude, like long COVID, long vax. I mean, everybody who comes to my practice, you take a history, Wade, and it's a litany of testing and appointments and visits to different centers. I mean, I have patients coming to me with a stack of evaluations from like the Mayo Clinic, and Mayo Clinic offers nothing, no treatment, never a recognition that the vaccine could be a cause. Many of my patients realized early, it's better now, but early on, they realized that you want a quick way to ruin a relationship with your doctor is you tell them that the vaccine made you sick. Then you get gaslit. But I mean, the stories I hear are just horrible. So the system's failed there, but and the research that into long COVID, and they don't even recognize long vax, right? So all of these academic medical centers, I'm sure UW-Madison has a long COVID center, and I will guarantee you it is almost 100% ineffective at helping anyone. But they'll call it a long COVID center. But as you were kind of said you were going to ask me, like in my private practice, I mean, we have probably a little over 1,200 patients we've seen for those two conditions. 70% are long vax, only 30% are long COVID. And how do you differentiate the two? You take a history. What was the event that preceded the onset of symptoms?
Right.
And said in 70%, they clearly can point to the vax. And so there's an epidemic out there. And the research into long COVID, right? Remember, there's no such thing as long vax.
On that thought, I've heard Peter McCullough. He's very articulate and very persuasive when you listen to talk, and he's put out a public call in a number of forums like, where are the research centers of excellence to study vaccine injury? We have an epidemic of vaccine injuries. No, I mean, what would happen if you started agitating for like if I was at UW and I said, I think we need to start a clinic for vaccine injury.
Well,
I'm making myself laugh because I'm thinking back to my years at UW, and I just that would be the dumbest thing I would have ever done.
you're not insane. The world has gone mad, like you'd said. You were part of, but by the way, that answer is great. I'm going to re-clarify for those of you who don't know the difference. When Dr. Pierre states long COVID, it's basically the same syndrome, but they're not acknowledging that it can be from the vaccine. Long vax is the history he's talking about. That is the context of this patient was vaccinated. Why are they struggling more than the long COVID who weren't vaccinated? Is this correct?
It's 100% correct, Wade. And what is common to the two conditions is the spike protein. The spike protein is the most lethal and toxic pathogen in history, in my opinion. So pathogen is something that causes illness. And I mean, the vaccine, it's just immense what it does. It causes so much illness, and they're so sick, Wade.
Okay, folks,
sick.
time out for 1 second.
Yeah.
Dr. Pierre was very, 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 before 2020, you were very pro
Vaccine.
Okay. So
All my kids are vaccinated.
What create okay, your daughter's scenario with pandas,
Yep.
if I may, I'm sorry if I
No, you
alluded
can.
too much. Please share with how much you've had to pivot everything you were basing your livelihood on prior.
Yeah, well, it's when you said like that, I'm a hero, and I didn't, and I said no, I just doing what I've always done. I mean, without sounding too grandiose, I mean, I just follow truth and accuracy. I just want to know the truth, and so with the vaccines, when they rolled out, I was a little concerned because I knew a little bit of the history of research into coronavirus vaccines, and it's really not pretty. Like the vaccinated animals died more than the other ones, ones who weren't vaccinated, and so I was a little concerned that we'd never had one, and suddenly it rushes to roll out. I looked at the trials. It looked very unfriendly. Just looking at the chart of the original trial, if you look at and they only followed side effects for like 7 days, but you saw like 58% of people with like fevers or chills or like malaria. I was like, wait a second, that shot's gonna give me 58% chance of going home feeling like crap.
Right.
I mean, 58% is extremely high. And there were other symptoms that were very high, like nausea. And then there was a lot of talk of like people needing to stay home for a couple of days. Do you remember that, Wade? Like people were
Yeah.
like, like they were missing work after the vaccine. I'm like, whoa, this is weird. But I wasn't paying that much attention because I was really starting to really get deep into the war on ivermectin. And so much so that my parents who live in Manhattan, I was like, just hold off. Because early on in January of 2021, a colleague told me like, hey, man, take a look at VAERS. VAERS is blowing up. You got to keep a look at that. And I looked at VAERS and I was like, I don't know. And no one did really analysis for me at that point, but it did seem concerning that 3 weeks into the campaign, there was like, I think 200 deaths reported. And, and then later on, I learned that in other failed vaccines in the past, they shut those vaccines down after like 50 deaths. And I think now we're probably up near 20,000. We're still pumping these things into people. But
And I
I
think
let, yeah.
Dr. McCullough, just real quick, Dr. McCullough had said, I just heard an interview, he said 31x, right? I think it's 31 times that is misrepresented in VAERS. So take that number and multiply it times 31 times. And you know this more than anyone, how often physicians are actually filling out the VAERS and what that means for their jobs.
For other vaccines and symptoms, that underreporting factor in other studies has been 100. So like for every whatever
Wow.
loss of hearing, it's actually 100 times. And with the deaths with COVID, there's been various calculations, but I've heard anywhere from 31 to 41. So like you're right. So the 20,000 deaths in VAERS, I don't want to do the math, right? Because it'd be 30 to 40 times that. And
Yep.
so you're in the hundreds of thousands. And so but here's the thing. My parents were begging me, like, we need to get vaccinated. We can't go to the symphony.
No friends will invite us over. We can't go to the restaurant. And I was like, you know what, Mom? Just get the J&J. It's one shot, like just get the J&J. I really didn't know how bad these things were. And that was in March of 2021. I did my own first deep dive into the vaccines in April of 2021. And it was because a lot of people were asking me about whether they should get vaccinated. And my answer was the same. I was like, if you've had COVID, do not get it because that's stupid. I mean, let's remember that part of the vaccine chapter, Wade, is that so in my book, I talk about like the two real eye-opening moments for me where like I really woke up when I was like, something's really not right here. Because the other stuff was revealed slowly, but the first moment when I started scratching my chin metaphorically was in March of 2020 when I was in the car listening to the radio. I was listening to NPR. Sorry.
Was that old Lucky Pierre or was that the pre-Lucky Pierre?
Did I just admit that in public? So I was listening to NPR and they announced that the FDA had restricted hydroxychloroquine to the hospital. And I'm in my car and I'm like, WTF? I was like, I didn't even know that hydroxychloroquine worked. I wasn't one of those guys. I was not an early recognizer or user of hydroxychloroquine, but all I knew is that if you're going to use an antiviral, you use it within the first hours or days of symptoms. There's no point in using an antiviral 8 to 10 days into the disease. So I'm like, again, this is when I was like, that is so stupid. Why are they so stupid? I should be running that show. And then fast forward to January of 2021. Vaccines roll out. I have colleagues who are internists. One of my old friends who's an internist in Manhattan, he was telling his patients were coming to him and he was saying, no, let's check antibodies first. If you have antibodies or if you've had COVID, you don't need the vaccine. So he would do with like any sensible physician. And I think a lot of physicians were doing that. Haha. What was the response of the FDA? Suddenly one day they put a posting on their website which says that there is no evidence to suggest that supports the practice of not vaccinating someone who's had COVID. And when I read that, I was like, whoa. That was the big, I think, launch from old Pierre to new Pierre. Because suddenly I was like, this isn't public health. This is about pumping up the market as large as putting as many arms available for that shot. Like I knew that was not science. And I knew that was, and I'm like, literally, they just want to add millions to the vaccine millions of unnecessary vaccine candidates. So that was like a big one for me. But even then, I didn't do the deep dive till April. And then after April, I am a bit of a COVID vaccine injury expert. I've written extensively about it. I've studied all about it. And that is really the danger of the vaccine is, again, it's a story of censorship. Actually, I have a draft post on my Substack, which I haven't been able to get to in like a week, but it's really about all of the most powerful and damning papers on vaccine injury. These are like big, large analyses showing the extent of injuries and deaths. And there's been a number of them, all retracted. And in my book on ivermectin, I have one chapter called The Editorial Mafia, where I literally print in the book numerous examples of some of the best studies of ivermectin. BMJ rejected, NEJM rejected, JAMA rejected, and even second tier and third tier rejecting positive studies of ivermectin. And then obviously they're only publishing negative studies of ivermectin. And then there were retractions. They were retracting these the ones that got through peer review and were published, like mine, boom, gets retracted. I mean, mine went through rigorous peer review, 3 rounds, 4 senior scientists, and the journal decides not to publish. Like, we're waiting for it to be published. And this is during the winter of 2021. And I'm like writing more frequently emails to the editorial office. And I'm like, hey, it's an online journal. It's been accepted. But when are you going to put it up? Like, people are dying. Like, let's go. And I think it was after about 6 or 7 weeks, I finally wrote a rather threatening email. And I said, I suspect scientific misconduct here because you're not publishing my paper. And within a day, the chief editor of all those journals, it was the Frontiers group, they called my editor, who was Robert Malone, he was the editor of the special issue that I was publishing in, and they had a talk with Robert, and they said that someone complained about my paper. The abstract had been posted. It was the most popular abstract in the history of that journal, by the way, just saying. Someone complained about the paper, and so they hired an independent, anonymous third-party reviewer who concluded that my conclusion, that the data did not support my conclusions, and they were retracting. I did not get submitted this critique. I did not get this peer review. This is just like a phone call about a third-party shadowy reviewer telling Robert that paper's not getting published. And that happened to Tess Lawrie, and so these examples I'm giving around ivermectin were magnified by 10 around vaccines. Like people, I'm sure your audience is knowledgeable, but the average person walking around is believing a lie. They do not know the truth. The truth is being censored to such a scale. And not only is being censored, but the propaganda, the constant messaging, the safe and effective, the TV commercials, the people celebrating that they're vaccinated, it's just, like Robert said, I saw something that he said a really powerful thing. He was giving a talk and he said, you have just witnessed the most sophisticated psyops campaign, military psyops campaign that has been directed at its own citizens. So the military, they have really highly skilled expert psyops capabilities, which is to say, propaganda and censorship. But the sophistication and strength and power of these messages, and I'll give you one example. So Mark Crispin Miller defines propaganda as a story or a message to get you to think or act in a certain way. And in my book, I have a chapter called the Horst Dewormer PR campaign. And I'll just summarize that by saying, that PR campaign, I go over how it started. It also relates to the FDA with that FDA tweet. That was literally what launched that campaign, right? "You're not a horse, you're not a cow." Stop.
Yep.
It's the most popular.
You're not an animal.
Right.
Yes, we are.
Most popular tweet in their history. And that campaign was executed, coordinated, and devised by, I think, assassin PR agency. You're talking about the most. They want to have a clickbait tweet.
Right.
You got it. I'm sure the invoice for that is very, very large, but they conducted that, and you had a 6-week campaign where, coming from every source of information, TV, radio, newspapers, interviews, public health agents, Horst Dewormer,
Yep.
and just hammering at our heads. And so you left with a population walking around thinking that the safest medicine in the world is literally only good to deworm a horse, right? And can I give you a little anecdote on that? So I was at an airport.
Please.
I was in that airport sometime like maybe a year ago, and I was on my way to Europe to speak, I think, in a parliament or at a COVID conference. And I'm sitting on the sidewalk, and there's this lady next to me smoking a cigarette. And we're just, I think, waiting for an Uber or something. We started exchanging some information. She's like, "Oh, so, what do you do?" And I was like, "Oh, I'm a physician." And she's like, "Oh, well, where are you going?" I said, "Well, I'm going to be lecturing at a conference." And she's like, "What's the conference about?" I said, "Well, I'm a COVID expert, and I'm one of the world experts on the use of ivermectin for COVID." And she goes, literally, I'm not making this up. Wait, she goes, "What? The horse dewormer? The horse dewormer?" And I'm like, "Yeah, well, I would check your media sources on that. You might want to change your information sources." She goes, "Really? You're going to lecture about?" She said it 3 times.
Yes, that's conditioning working. Obviously they know how to do this. They've been practicing it for years. When we say they, just whoever they is, the Committee 300, whatnot. But the point is this, that, by the way, I'm respectful of your time here. You got a hard stop when? Like 2 minutes?
If we could, like in 2 minutes, if that's
okay.
all right.
So it's back to you. I don't want to talk. The question I have for you is, what did Dr. Fauci say about childhood vaccines and research? Can you just summarize what he knows about that? Do you remember? I can read it, but
I'm trying to think what you mean specifically.
okay. So it was in chapter. Let's see, it was page 132. But
is that what I'm talking about? Bobby and Dell at the NIH?
Yes, the first skirmish, and then he comes clean and actually on the call and says, "We don't do placebo-controlled trials with childhood vaccines because they are unethical."
Yes, now I realize what you meant, but yeah. So So briefly, that little anecdote related to the fact that after my ivermectin testimony, one of the House of Representatives sits on the committee that oversees the health agencies, they got the NIH Treatment Guidelines Committee to give me an audience, meaning, so I presented with Paul Marik and guy named Andrew Hill from the WHO, and we presented all the evidence of ivermectin to the Guidelines Committee. And so there's a little bit back and forth. And then at the end, I ask a question, just a question to like this committee member of like 22 people. And I just said, because they even asked, they said, do you have any questions for us? And I paused because our game plan was to go in very deferential, collegial, not abrasive or attacking, but you got to remember who they invited.
You're from New York.
Yeah, I'm from New York. So like I'm just sitting there and I'm like, yeah, I got a question. And I said, out of all the therapeutics that people have thought effective and been trying to use, like hydroxychloroquine, monoclonal antibodies, and convalescent plasma, I said, how come all of those enjoyed a neutral recommendation, whereas like there's insufficient evidence for or against? I said, it's curious that ivermectin has always had the recommendation to not use outside of a clinical trial. I said, is there a reason why that is? Like, why is ivermectin, have that recommendation, the others don't? And it launched a 14-second pause because I recorded that Zoom. And so it's like a 12, I think it was a 12-second pause. I'm having dinner at a convention with Del Bigtree, and I'm telling him this story. And Del goes, no way. He's like, that same thing happened to us. He was like, we were down at the NIH. We had Fauci at the table, all of these vaccine experts, and we're asking them for evidence of a placebo-controlled trial of a childhood vaccine with a true placebo. And I think their first answer was, yeah, we got them. There's a paper. We'll get them for you. And they were like, well, can you get that for us? And then there was like some silence. And then I think they asked one more pointed question on like, where is the study that has a true placebo? And then there was what Dell and told me is that there was a 12-second pause at this committee. So that I call it the NIH pause, like when you ask a challenging question. And then I think it ended with Fauci says, we don't do placebo-controlled trials because it's unethical. Right. So anyway, that's a crazy anecdote.
Well, and I think it points to your history of when you'd said first of all, I watched your testimony when you were here in Wisconsin testifying on behalf of childhood vaccines, meningococcal. That was a huge, huge, huge video. I remember sharing that wide and far. I was so proud of you. And I don't say that from I'm just saying I was awestruck by how you just laid it all out there for them in a nice sequential way and were very transparent, very human, but also very clinically reputable to be able to lay that down. So not only do the families in Wisconsin thank you because I'm part of the freedom movement here, that we believe in everything you're doing to bring the power back to the people. That sounds a little rah-rah, but the reality is we're dealing with a fascist government right here. You'd said it, when corporate combines with government, that's what's called fascism. So that is what we're doing. I know you have to go.
Wait, yeah, I'm gonna go in a second, but I gotta tell you that Wisconsin testimony, I gotta tell you, I was a bit on fire that day. I actually am really proud of that because we literally stopped a mandate for 2 other vaccines. And going back on some of the themes we've touched on, you saw what happened. That was a Republican-friendly committee. That's who invited me. The chairman I heard was a fan of my work, right? But what happened in the questioning? Who went after me? Democrats, right?
Mhm.
We got into a little tiff. And so you see this testimony by a researcher and a clinician, and I'm being differentially received. That information is being differentially received by political factions, right? So it's just crazy. But the last thing I want to say is, as a former professor, if you're an academic and you're a professor, and I met criteria for a professor when I retired, but you literally are responsible to share your expertise with the public as an educator. That is why we have these academic protections and tenure and research and supposedly objectivity. And I just want to finish by saying, after reading Turtles All the Way Down, that was a transformative book for me. And once you have the knowledge of that's so carefully and comprehensively presented and cited in that book, um, you can't be a credible physician if you don't go around and absolutely warn people away against vaccines. Vaccines are a myth, or the efficacy and safety and impacts of vaccines are a myth. They're a complete myth. They don't do what apparently the history books purport that they did. Like this, again, that's propaganda. That note, we have, like, I've been living on false notions. I've been propagandist my whole life. I mean, I ran around thinking vaccines were the greatest thing since sliced bread. It's just simply not true. And that's a scientific statement. It's not a political statement. It's not because I want to be an anti-vaxxer. And by the way, that kind of, when you start having those scientific opinions like Bobby, what happens to you? Inconvenient scientific opinions. I mean, it just gives them more stuff to it. Don't listen to this guy. Let's look what he says. He says vaccines you should avoid vaccines. Right. I'll finish, Wade. If I had young children today, they would not receive one single vaccine. Period. Full stop. End of story.
Mic drop. Where can people find you? I'm part of your Substack. I will include all this information. You tell them in your closing thoughts, what do you want them to know? Where do you want them to buy the book?
Yeah, book probably best on Amazon because it helps the rankings and all that. And then my private practice, which sees everything, but we do a lot of long vax, long COVID, also some complementary cancer care. But that's drpierrekory.com. So drpierrekory.com. And then my Substack is pierrekorymedicalmusings.com.
Yep. I'll share all that in there too.
Of course, flccc.net.
And you're on there and published.
That's my nonprofit, the flccc.net.
By the way, I am so grateful for you. My close is I love and appreciate you, and we haven't even met personally yet, but I feel like I'm one of your biggest fans from what you actually go out and do, and all the pain you deal with every day. Like you just got on the phone today or on the Zoom and said, I got a lot of basically a shitstorm you're dealing with. So I appreciate that. And not only you taking your time, brother, thanks so much for your time and everything you're doing. Appreciate it. Have a great day. Ciao.